All right, question number 4 from Dr. Imjad, part of the first 5 questions submitted by him, but hopefully I will make this a series of videos answering questions about levodopa. What is the clinical relevance of delaying the onset of dyskinesia? So dyskinesia is the restlessness the Parkinson patient gets when the levodopa is taken or Parkinson medications are taken is related to a high level of dopamine in the blood that goes into the brain cell absorb it, they start making more dopamine, and much more dopamine makes you restless and fidgety and kind of moving all over the place and cannot sit still. That's dyskinesia. Is there any advantage to delaying the onset? That kind of ties in with the last question that I just reviewed, where I said that if you take less levodopa, you can delay the onset of motor fluctuations like dyskinesia, and the less you take, the more you can delay it. So the least that you can take is 0. So if you don't take levodopa for a while, you will really delay it. But is there any advantage to it? Because we talked about disadvantages. If you're not taking levodopa, or if you're not taking enough, you're not able to keep up with your work, you may have to retire, you may not be able to do exercise, you have no energy, you stop socializing, you can have depression. So many things can happen because of lack of dopamine. So if you take less, and you're giving up on motivation and energy and dopamine that you needed, are you getting something in return? Is there any advantage to it? And my brief answer is no. There is no advantage to it. And the details will be, well, dyskinesia usually is often not recognized by the patient. So the patient doesn't know what dyskinesia is. And you may see a mild dyskinesia, you tell the patient, you have dyskinesia, is like, he says, what is dyskinesia or what dyskinesia? It may not even be noticed by the family until you point out that this is dyskinesia. They say, oh yeah, he or she does that often. I use he as a patient in my videos often, mainly because it's 2 times more common in men than women. So you are twice as likely to see a patient which is a man as compared to women. I'm not sure it's a great thing to beat women at having more Parkinson's, but that's what we have, and it's not because of a gender bias. So if if a patient are not recognizing, they do not recognize dyskinesia, they're not bothered by dyskinesia. Many a times patient can tell that medication is kicked in by the feeling of dyskinesia. So if you take that away, they cannot tell the medication is kicking in, and they may come back and say, oh, medication is not working, because you can see a difference, but they cannot tell that it kicked in. Their tell is gone. So a lot of time I ask patient, can you tell when your medication kicks in? And they say yes, and I say, okay, how can you tell? What's your tell? What's your giveaway finding? So there's a lot of negativity or lack of any concerns related to dyskinesia. When is dyskinesia concerning? Dyskinesia can be concerning for 2 reasons. When they are causing so much energy expenditure from movement all over that that they're losing weight, or the dyskinesia is so bad that they can hurt themselves by falling or hitting into things when walking or even when sitting. Yes, dyskinesia can be that bad that they can not even sit in the chair, that they're so bad. So there is downside to it. But how often do we see these bad dyskinesia? I don't know, maybe once in 6 months, 2 or 3 times a year. I may have few patients I can count on my finger who have that bad of a dyskinesia. And we can do a lot about their dyskinesia. And maybe that's why I don't have many bad dyskinesia, because as soon as I start seeing a dyskinesia that looks concerning, I can do quite a bit of things. I can smooth out the day. I can put them on duopa. There are FDA approved medication for dyskinesia, extended release amantadine, gocovri, and Osmolex ER. There is immediate release amantadine. There are new drugs being studied, and now there is deep brain stimulation surgery you can do for smoothing out or getting rid of the dyskinesia. So dyskinesia can be managed easily, is not bothersome, is helpful for patient. They can tell it. They may not even notice it. So many things about dyskinesia that it's to a point where you will say, I don't know if there is any advantage to delaying dyskinesia anymore.